I was shopping around for the right frame to gift my friends who just got married because I had the cutest photo of them. The FrameBridge website made it so easy to preview options that I slipped in a photo from my trip to Japan for myself too. Now they've got a wonderful memory of their wedding, and I've got a new favorite piece of art in my house. FrameBridge has a curated selection of frame styles and design experts to make it fun and easy to frame what you love for the people you love. Visit framebridge.com or your local FrameBridge store at 1200 Villa Place in Edge Hill to start framing.
Today on CityCast Nashville, President Trump's big budget bill has been signed into law, and big changes are coming to your healthcare because of it. Michelle Johnson, Executive Director of the Tennessee Justice Center, is here to explain how the bill's cuts to Medicaid will impact Nashville and our neighbors across the state. It's Monday, July 21st. I'm your executive producer, Whitney Pastorek, and this is what Nashville's talking about. Before we start, I want to say an incredibly heartfelt thank you to everyone who became a CityCast Nashville neighbor last week during our membership kickoff. It means the world that y'all want to be a part of what we're building here. I still can't believe my job is to facilitate conversations with Nashvillians from every corner of the city to help us learn more about each other. Y'all, I still believe in Nashville because I believe in us. And today's episode is as good an example as you're going to get of why we need each other now more than ever. I know, I hate that phrase, but it's true. To our new members, thank you for supporting work like this. And hey, it's not too late for everybody else to join. Head over to membership.citycast.fm now and check it out. Can't wait to have you in the neighborhood. On to Michelle. President Trump's budget bill has been signed into law. It includes $1.3 trillion of Medicaid cuts that both of our senators, Marsha Blackburn and Bill Hagerty, voted for. Medicaid here in Tennessee is called TennCare, folks, just so you're aware. So how many Tennesseans who get their health care through TennCare are projected to lose their coverage because of this?
Due to changes that Congress passed with respect to Medicaid, about 110,000 will lose coverage, and then another 140,000 will lose coverage based on the changes to the Affordable Care Act. And this is estimates by the Nonpartisan Congressional Budget Office. So we'll have about 250,000 Tennesseans who will be without health coverage. That is going to be just devastating to many in our state who rely on TennCare and the ACA to have some peace of mind and to access the services they need.
Wait, so Affordable Care Act coverage is changing? So like the folks who are going to go to healthcare.gov during open enrollment and pick their healthcare, will they still be able to do that this year? How is that changing?
Well, so there were enhanced premium subsidies that made healthcare through the ACA more affordable, and those will expire at the end of this year. Over 500,000 people in Tennessee get their health coverage through the Affordable Care Act marketplace.
And just to explain those subsidies a little bit more, I have vast experience with this thanks to my lifetime of freelancing. But this is, I go in there and I pick a plan and it says, oh, based on your income, you pay $125 a month for this. And what I have learned through accidentally making too much money one year as a freelancer is that that was subsidized by $300-$400 in some cases. So then at the end of the year, my tax bill came due. So that means that these plans that are affordable, that are in the $80 to $125 range, now are potentially going to be as much as $500, $600.
That's right. It'll just make it completely unaffordable for people who are middle class to access health coverage. We enhanced the premium subsidies in the last administration because the cost of the premiums were so high, people couldn't afford health coverage. Once the premiums were enhanced, there were lots more people who accessed coverage, who didn't have to worry about medical debt, didn't have to worry about going without care that they need to spot their chronic illness or to spot a cancer diagnosis. And now we are going to go back. We're going to go backwards. And in fact, in some ways, that sort of cut is massively damaging to the ACA. The whole point of the Affordable Care Act is that everybody is going to be covered. And so this is a massive loss of coverage, which will obviously impact people who are on these plans, but it will also impact hospitals. And so, we are tied for number one in the nation at rural hospital closures. But with the loss of Medicaid coverage and Affordable Care Act coverage, according to the experts who research hospital sustainability and hospital viability, they say Tennessee will lose another 9 hospitals.
I mean, according to Becker's Hospital Review, over 41% of rural hospitals in Tennessee were already at risk of being shut down even before this bill. So let's just jump and talk about that really quick. When these rural hospitals close, does that put a strain on our local hospitals here in Nashville?
Well, it puts a strain on everything. The healthcare infrastructure is built in such a way that everyone has a role to play. And what we've seen, because we failed to expand Medicaid, is that we have healthcare deserts in rural West and rural East Tennessee. So once one hospital closes, then everyone floods to the next closest, then that hospital closes, and it's a domino impact. We've gone to those communities when a hospital closes. It's usually the largest employer in those communities. When they close, they don't just impact those who work at the hospital. They also impact small businesses around the hospitals, those who do laundry, those who have restaurants. It is gutting rural Tennessee when you basically have policy by politics as opposed to making decisions based on how do we get and keep a healthcare infrastructure that works for all of us. And then obviously, God forbid someone has a car crash going from here to Memphis or from here to Johnson City, because many people will not survive. When these hospitals aren't there when you need them, you often can't make it to the next hospital. So if you have a heart attack, a stroke, many of these rural communities are trying to make it a retirement community. They're gorgeous, beautiful Tennessee. If you're older, you're not going to go to a place where there is no hospital. And of course, then the doctors and the other healthcare professionals leave those communities as well. So basically, there will not be a healthcare infrastructure that makes sense. Lastly, even in Nashville, when people lose their coverage, which they will, that increases uncompensated care. And that uncompensated care is then passed on to the rest of us who are insured in the form of higher premiums, higher cost. So it's estimated that about $1,000 a year is taxed to U.S. families for uncompensated care. In other states, most every other state in the nation has expanded Medicaid. They don't pay that extra $1,000 because they don't have the uncompensated care that we have in Tennessee. But we're all paying for the leadership failures of this administration, both state and national.
Well, you mentioned older adults, and that brings us to the part of this that freaks me out the most for my mom, who's in her 80s. Is Medicare at risk too?
First, let me just say that for older Tennesseans, about 60% of those in Tennessee's nursing homes, long-term care facilities, are paid for by Medicaid. Medicare does not pay for long-term care. Medicaid pays. So anybody who is in a long-term care facility, the vast majority of those people are getting those services paid for through Medicaid because they paid into the system. And when they are in their final chapter, they should be able to know that they can have care with dignity. There's 2 provisions that are really important to note. One is that the Biden administration established nurse-patient ratios for nursing home care, because as you might imagine, oftentimes they're short-staffed. Oftentimes people desperately need a nurse and they can't get a nurse to come when they buzz. This bill makes it immediately the law of the land that there can be no nurse-patient ratios in nursing homes. Not only did they do away with the ones that were there, but they said legally no president may ever establish nurse-patient ratios in long-term care facilities. So that's one aspect. The other aspect is when you think about taking over $1 trillion out of Medicaid and you think about 60% of seniors in nursing homes relying on that program, we know that is going to have a devastating impact on the nursing home infrastructure as well as older Tennesseans who need that. Medicare pays a different part. They pay not for long-term care, but they pay about 80% of hospital costs. And of course, Medicare is a program that older Tennesseans have paid into through their employee taxes. There are some areas where it will be impacted we know of right now. One is that many of our clients get Medicare's premiums paid for by Medicaid, Medicare savings plans. And that means if you are poor and you don't have enough money to pay for premiums, you can access Medicare through Medicaid paying for it. That will be majorly impacted by these cuts to Medicaid. The Medicare details of how they're going to cut Medicare are not really clear from the bill. We do know Medicare advocates have said that when you increase the deficit by $3.3 trillion, that puts a strain on the Medicare trust fund, which means that they know there are going to be cuts coming. We just don't have the details of how those cuts will play out and when they'll play out. I want to say I'm glad that they didn't specifically say anything about Medicare, but the impact on seniors of this long-term care policy change are really going to be harmful. And they're going to be harmful not just to older Tennesseans who want to have a final chapter with dignity, but the rest of us who are working and we're taking care of our kids, and now we're going to be taking care of our in-laws and our parents on our couch. And, we need labor participation in our state. This is not going to help that. If somebody needs to be cared for as opposed to getting that care in a facility, that's going to be really harmful for our labor participation rates in Tennessee.
It just seems like a cascading spiral, the way you're explaining it, that it's going to impact everyone. People who support this legislation tend to believe that those entitlements, as they call it, are just for people who are sponging off the system. As you've pointed out now twice, I think you've mentioned that this is a system we all pay into throughout our lives. So how do you respond to someone when they say to you, well, those people need to get out of their mom's basement and just get a job? What is your response to that?
The last 50 years, employer-sponsored health insurance has been going down, down, down. So most people who have jobs do not get employer-sponsored health insurance. And even if they have access to it, the cost of it is so large, it's such a high percentage of their income that many cannot afford it. And even if they can afford their coverage, dependent coverage is almost impossible to afford for the vast, vast majority of Tennesseans. And so when you look at the 1.4 million people on Medicaid, it's important to note that half of those 1.4 million people are children. There is no other system that's meeting those kids' needs. And we have about 40 years worth of research that shows if you give children comprehensive health coverage, they earn more as adults. They're less likely to depend on public programs. They're more likely to go to college. They're less likely to have any interaction with the juvenile justice system. We know that this works, and it's not because they're getting something that they don't deserve. It's because they have access to the care they need to soar, to thrive. The politics of it has changed over the course of the 31 years I've worked, but the science hasn't changed, which is people do better when they're able to not be sick and when they're able to have their health needs met. The other half of the people on the Medicaid program are people who are pregnant. So in addition to pregnant women, I think there's a misunderstanding of who gets Medicaid. In Tennessee, you get children, you get pregnant women, you get parents of young children. And parents of young children only access it if their income is low enough. They have to have very, very low income. And then seniors, last group is people with disabilities. So people with such severe disabilities that they cannot work under any circumstances. So this idea of people living on their couch and sucking off the system, those people are they're what we call in the coverage gap. They're going without health care right now, without mammograms and colonoscopies, and their lives are being shortened. We are number one in the nation at maternal mortality. And you're like, how can that be? You're 2025 in the richest nation in the history of the world. And that's because you can't access care in our state until you become pregnant. If you're poor and your employer doesn't offer health insurance, or they offer health insurance that's half of your salary, you don't get health insurance till you get pregnant. And so if you have any underlying condition that might put your life at risk, oftentimes it's too late. Oftentimes it's too late to get the care that you need to survive. And so we are burying mothers before baby's first birthday at a rate that is higher than our grandparents, which seems really breathtaking and heart-wrenching. And so when folks say these people are taking advantage, I just have to say, who isn't? Who is it that you think is on this program? Because this program, many of the folks, and we've done this, I've worked here for 30 years. I talked to last year, we had 3,000 individual clients, folks from Memphis to Mountain City. Many times people are working 3 jobs and none of them offer health insurance. If they could get health insurance from a company, they would be really thrilled with that. Many rural employers don't offer that. Actually, hospitals in rural communities did offer health insurance. And because of our failure to expand Medicaid, we've closed lots of those employers. There's a huge number of veterans that are on this program, on Medicaid and on the ACA. Why? Because getting a job after you've put your life at risk for our country, getting a job that offers health insurance is very unusual in our state. And is particularly unusual when we have schools that are failing and not giving kids the skills they need to have some of these higher level jobs.
This episode of CityCast is sponsored by Babbel. Learning a new language opens the door to new friends, new cultures, maybe even a whole new life. So why not start that journey today? You can start speaking a new language with confidence thanks to Babbel's conversation-based technique that quickly teaches you useful words and phrases about the things you actually talk about in the real world. I'm CityCast CEO David Plotz, and I've been learning Spanish with Babbel, just one of the 12 languages you can learn with it, including Dutch, French, Italian, which is going to be next for me, Turkish, and Russian. I love the interactive dialogues that Babbel has, which allow me to practice what I've learned right away, and also the speech recognition function, which makes sure I'm getting the pronunciation just right, which honestly, usually I'm not. Also, I love that Babbel's lessons always cover actual things that I talk about in the real world, like food, talking to people I've just met, and also food. Staying motivated to learn a new language has never been easier thanks to real-time feedback, progress trackers, and handy visualizations in only 10 to 15 minutes a day on Babbel's mobile app or website. So get talking with Babbel. I want you to learn another language, so I'm teaming up with Babbel to gift you 55% off subscriptions, but only for our listeners at babbel.com/citycast. Get up to 55% off at babbel.com/citycast. Spelled BABBEL.com/citycast. Babbel.com/citycast. Rules and restrictions may apply.
I want to talk about one more aspect of this that is going to be potentially challenging specifically for us here in Nashville. You know, one of our biggest employers is Vanderbilt University Medical Center. This year, they've announced $250 million in federal budget cuts. They've begun mass layoffs. How will these cuts continue to affect them and other universities? And how will they continue to affect the healthcare industry, which is a big driver of our economy, with giant local employers like HCA and Ascension?
There's no question tens of thousands of jobs will be lost throughout the state. And the jobs that were lost at Vanderbilt were due specifically to the loss of NIH funding. And so NIH funding is really important because they're curing illnesses that will lengthen lives and that will enable fathers to see their children grow up. The amazing innovation that has happened at Vanderbilt and at other NIH grantee facilities around the country should make us all proud to be Americans. And so to just say we're going to stop funding all of that creates a perfect storm for Vanderbilt, because Vanderbilt's Children's Hospital, for instance, has a huge number of Medicaid TennCare children that go there. So it's not only half of people on Medicaid are children, but also half of the children in the state rely on Medicaid. And so as you might imagine, their children's hospital very much depends upon Medicaid TennCare dollars to stay open. That's going to be just devastating. And it's not just Vanderbilt, you know, as you say, it's Ascension St. Thomas, it's HCA, we're the healthcare kind of ground zero for healthcare. And the cost of these cuts, which many legislators said they didn't actually read the bill. You know, we have a senator from Missouri now coming back and saying he wants to undo his vote and bring back the vote again, even though he voted for it. It's going to be devastating. And all of them stepped up and said, yes, we want to do this. It's going to be devastating all across the nation in ways that I think, having done this work for a long time, is going to be politically horribly damaging. We sat through this movie in 2005, and people of both political parties lost loved ones. Those people continue to come to us and say, I will never forget that you stood by me during that, and I will never forget who is to blame for those cuts. And so I think they think that this is like any other policy. People will be mad and they'll get over it. But when you lose a loved one, that doesn't go away. You never forget it.
You've mentioned your work quite a bit, so I really want to give folks at home the opportunity to learn about what the Tennessee Justice Center does. You work with these individual clients, but are you a solution for people who are going to experience devastating loss because of this? Can y'all take care of everybody?
So we're small. There's 30 of us, but we represent people statewide, and we help people navigate the red tape so that they can keep their benefits and they can get the healthcare their doctors prescribe. Oftentimes when you are sick, you just don't have the capacity to fight, and there's so much bureaucracy and so much red tape. And so we stand with families to ensure that they get what they need to thrive. Last year, we helped about 3,000 individuals from Memphis to Mountain City. We don't have the resources to help every single body, but what we do is we look for patterns in the individual cases that we serve. We lean on partners. We do lots of trainings for partners so they can help clients as well. And between the clients and the partners, we figure out what are the system issues and how do we address system issues. So we actually have a court case where we won at the end of 2024, where the federal judge said in 120 pages that the system for redetermining TennCare eligibility is broken. It's illegal, it's unconstitutional, and it creates outcomes where people who are eligible lose coverage because of the state's ineffective eligibility process. The judge actually, his quote was, "You shouldn't have to have a lawyer to access the health care that you need to thrive." Sadly, in Tennessee, you do. One of the provisions of the BBB says that instead of asking people to prove they're eligible every year, they're going to make people prove they're eligible twice a year. And we know from, again, years of study that people's income doesn't change that rapidly. And so what that means is enormous investment in administrative cost. And also what they hope is that people can't run that gauntlet. And if the system is broken, as the judge found that it was, then people will be cut off even though they're eligible. So some of the examples of what the court heard were people getting, they were supposed to fill out a packet, but the state sent their packet to somebody entirely different, to a city they'd never been to. When they called the state and said, "Hey, I've lost my TennCare," and they say, "Well, you didn't fill out the packet, and here's the address we sent it to," and the person says, "I don't live there." They said, "Oh, I see here you live somewhere else, but you still lost coverage because we sent it to the wrong place and you didn't answer it." Again and again, that was the witness's testimony, that they did not operate the TennCare process in a way that was fair or legal to folks. And we're talking about a dad testified about his child with leukemia. A mom testified about a child who was dying, was literally dying, and that could not get the peace of mind to know that the child's final days, they would have the health care they needed because of just the red tape and in some ways, this sense of like, we're going to make it as hard as possible for people because somehow these people are trying to trick us. They don't deserve health care, which seems completely divorced from the realities of the people that we serve. So we have had the ability to impact, about 1.8 million people through our policy work, through our, spotting these patterns and fixing systems. We're very humble about trying to make sure that we assume the best about people who are working in the system, but they can't know. They can't know what's happening on the ground. And luckily, we have access through our clients' trust to know what is happening on the ground and when it's not working, bringing that to the attention of state officials.
I can hear your colleagues in the background working hard. Maybe our listeners can too. What specific advice do you have for Nashvillians who are at risk of losing their medical coverage right now because of this bill?
Follow us on social media. And if you go to tnjustice.org/join us, there's lots of information about using your own voice. We think it's worth continuing to push for these premium subsidies to be reauthorized. But if you follow us on social media, we can often give tips and tricks about how to navigate the system. And definitely feel free to call us or to send dollars so that we can grow and expand our reach. You've heard people in the background because we have 20 volunteer summer interns. And it's been great to have like the cavalry riding in to help us at just the right moment. But we are super excited to use the talents of anyone in the state. We know that we can wrap our protection around these Tennesseans and keep them from losing coverage. And so just join us in that fight.
And I think because of the concern about increasing medical debt, do we have any solutions here in Nashville to help people potentially decrease their existing medical debt?
Well, I think it's really important to write to hospitals and ask them to forgive debt. There should be, and every hospital has a duty to place their charity care on their website in a way that's very accessible. And oftentimes you would be surprised about the income level at which you can still qualify for charity care. So don't hesitate to write to hospitals and ask them to forgive that. We actually have a whole medical debt section on our website that lays out write to your hospital, let them know why it's hard to pay. Let them know if you'd be willing to pay, $2 a month or $3 a month. Oftentimes these hospitals have the ability to write off those bills. According to the last administration, the Consumer Protection Financial Bureau passed a regulation that said medical debt can no longer be considered on your credit report. That was incredibly freeing for so many of our clients who, through no fault of their own, had a car accident or who got cancer. And so they couldn't ever get a house. Well, that has now been undone. I don't understand how, I just don't understand the moral authority of punishing people who have a bill that they owe that they can't pay for when it comes to medical debt. The other piece we didn't even talk about, but there's going to be massive SNAP food stamp changes, which are going to decimate that safety net. We're very worried about people, the impact on health of people not being able to get the food they need, for children to not get the food they need to thrive. But we don't have time to go over all that.
I think we'll need to have you back for that one, because I think that is a immediate concern for so many people in Nashville, especially given the cuts we're seeing to Second Harvest and so many of our safety net organizations that do help mitigate food insecurity here. But, to go back to that imaginary person I was talking about before who thought that these are entitlements and it'll help save the national debt and all of that such thing, I think you've really laid out why healthcare for all matters to the greater good. But it does feel like one of those issues that people don't necessarily fully understand until it happens to them. Have you experienced something in your own life that led you to this work? Is there a story that you can use to help people understand from your own experience why all of this is so important?
Lots of stories. I didn't come into this work by accident. My dad had his first chronic illness diagnosed at 21. And before he died, he had 13. He had serious cancer. He had heart disease. I spent a lot of my childhood in a hospital. He worked at Ford Motor Glass Company. Ford Motor Glass was a plant here in Nashville. And even though he was brilliant and he could have worked elsewhere, he said, I can't leave here because without this health insurance, we would be bankrupt. And I saw that terror of living for the health coverage and knew that isn't right. Like, you should have the ability to explore your dreams. You should have the ability to work in a place that really uses your talents, as opposed to constantly be worried about losing everything. I was the youngest of 6 kids. We didn't have a lot of extra money. And he had diagnosis after diagnosis of cancer and, ulcerative colitis and all of these. And in truth, he was born during the Depression. He had all the diseases of starvation and so was turned down for the military because he had rickets and he had scurvy and those things. In America, again, in the richest country in the history of the world, that we can't field a military, which is the reason why Medicaid passed. Regulations around children and Medicaid passed because during the Korean and Vietnam War, they couldn't get enough military because of these diseases of starvation, because of severe poverty. Kids weren't healthy enough to fight for us. And so the policies that we have to have need to put aside our cynicism and hate and just think, okay, what would I want for my own family?
Thank you so much for sharing that. And honestly, Michelle, thank you for the work that you do, that your team does, that your 20 interns are doing to ensure that people here are educated and know what resources are available to them. So yeah, we're going to put a link to their social media in our show notes. Y'all go give Tennessee Justice Center a follow. And Michelle, is it okay if we have you back on as this continues to unfold to keep us updated on all these changes?
100%. Love to be here.
Okay. Thank you so much for your time.
You bet. Take care. Thanks for having me.
And y'all, if you're looking forward to our next chat with Michelle and other great guests just like her, the best way to support what we do is to visit membership.citycast.fm and become a CityCast Nashville neighbor. I want to shout out our latest crew of awesome neighbors: Christine L., Kristen K., Hal C., Susie R., Ginny W., Coney G., Joyce R., Shelby C., Ron H., Chris P., Laura T., and my mom for coming in just under the wire. Thanks, Mama. And we just got a great comment from new neighbor Vanessa H., who wrote in to say, I love tuning in to see what's new in Nashville. Before finding the podcast, I had lived here 2 years and still felt disconnected from local knowledge, political happenings, and hidden gems. I've thoroughly enjoyed exploring the area more based off topics and suggestions you've all discussed and learning about our amazing city. Vanessa, we're so glad you're here. Thanks for being a member. And thanks everybody for sticking with us through our membership launch week. We're so excited for what comes next. That's all for today here on CityCast Nashville. I'm actually on vacation this week because today is my 50th birthday. Oh, Lord. If you'd like to help me celebrate, become a CityCast Nashville neighbor. Or, hey, just come to East Nashville Beer Works tonight and say hi. I'd love to meet you. And if you enjoyed the show, why not tell your friends, rate the show, leave us a review, and subscribe to our Hey Nashville newsletter. We'll be back tomorrow morning with more news from around the city. Y'all take care of each other.